And thanks for having us. It's a real pleasure to be here, and it sounds like it's going to be a really interesting conversation. So just to check, I'm hoping you can now see that slide on screen. Good, some good nods.
Yep.
So to introduce myself, I'm Hannah Tower. I'm the project manager for this project, which we're going to talk about, the Pathways to Work Commission. But also on the call is Tom Smith, Barnsley Council's Head of Employment and Skills, for any questions and conversations, join in. Annalise Davis-Torney, who's an undergrad doing her placement year with us, which has been really interesting for her as well, I hope. So we'll just take you through a bit of an overview, first of the Commission itself, what we've been up to, second, a few reflections on health and some of what we've been thinking about and finding there, and a final comment on some of the impacts we are hoping to make. So an overview of the Commission. Back in July 2023, about a year ago, this commission was set up. The key questions up there in the top left: how does Barnsley enable all of our working age population, particularly those currently outside the labour market, achieve pathways to employment? And we'll come on to some of the data around why it felt so urgent to set up this commission. But what is really exciting for us as a local kind of area, as a place, is actually just getting a totally fresh set of eyes looking at what is going on the ground in Barnsley and how that's interacting with the national picture. So you can see on the right there the list of who has been part of this commission, and for us that's just been a really positive experience. So directors of a few different national think tanks, bringing different perspectives on health, work, and kind of economic incomes, activity, a couple of political representatives, and then a range of professionals across the adult education space, young people's education, data, chief financial officer from Every, health, and a behaviourist, all chaired by Alan Milburn, who was Secretary of State for Health in the early 2000s. So it's been a great process for us. They've been working as an independent body, but with the secretariat provided by Barnsley Council and real support from SIMCA, the South Yorkshire Mayoral Combined Authority, as well. And we've had kind of regular observers sitting in on those commission sessions when we've brought this group of people together. So why did we need to do this? Well, the challenge has already been talked about in high level terms nationally, but in Barnsley, only 69.7% of the working age population are in employment, according to the latest LFS data. Bearing in mind there's a few kind of quality caveats still around that data, but just under 70%, whereas the national average is about 5 percentage points higher. Our unemployment, however, is actually comparatively pretty low, under 3%, so at 2.9. And the difference there is that our economic inactivity rates are 27.1%, so that's a whole quarter higher than the national average. And that is a really different situation to some of the challenges Barnsley has historically faced. So it was provoking a lot of interest and a sense from our local elected members, from communities, from businesses, that we really need to get our heads around what we can do to support more people into good work. So looking at who's inactive in Barnsley mirrors lots of the national picture. Over 2/5 of those people out of work are long-term sick, but it's a higher proportion of our cohorts than nationally. About 1/5 are looking after family or home. We have slightly more early retirees than above the national average, but we have fewer students. So interesting to kind of look at that breakdown, and the survey data nationally suggests around 1 in 6 of these individuals want a job. Our own data and research from the Commission actually suggests that number could be quite a lot higher if people were asked whether they would take a job that aligned with their skills and circumstances. So our conclusion really, and the kind of driver of this commission, is that there's a cohort of people in our borough and repeated across the country who need better pathways to work. So what have we been up to? A whole lot. It's been a busy year. So we've been gathering a lot of evidence. A lot of that has been through resident engagement. It's one of the real benefits to us of being a place-based exercise. So we've engaged 750 South Yorkshire residents through a telephone survey, a huge wealth of data there, and all kind of weighted and statistically significant, which we're really looking forward to sharing more widely. But alongside that, some qualitative research, so 57 in-depth interviews with Barnsley residents, primarily out of work, a few success stories who've made it back into employment, and then follow-up focus groups with those residents to discuss solutions. Alongside that, trying to keep track and analyse the many reports that have been coming out in this field over the last couple of years. We've had over 100 different partners and experts providing evidence to the Commission, and we've held 8 Commission sessions to consider that evidence and identify solutions. So some of the topics at the bottom there. Just a bit more detail on the research on the left-hand side. The primary qualitative research was done by CADA, who are based in Sheffield. The telephone survey was done by IFF Research. And alongside that, a couple of other bits. So we did a local business survey. As ever, challenging to engage businesses, but we've got a lot of existing data and comment which we can draw on as well. And then we put quite a lot of time and energy into trying to explore the local data and running a local data pilot, because that is something we'll come on to in terms of the challenges for a place like Barnsley in identifying and reaching out to people who might need help to work. So quite a lot going on, and happy to come back to any of that. Now, this slide was made before yesterday, so our report launch dates might all be changing quite swiftly. I felt like Rishi Sunak had me in his sights there. It was almost exactly the same sort of timing as our planned report launch, but the process that we've been on is visible there on the left-hand side. So our journey really has been starting with understanding just nationally and then locally who is actually out of work. Amongst that cohort, who needs help to work? We know lots of people are quite contentedly retired or studying. And then the evidence base helping us develop an understanding of what actually helps, what makes a difference. And we've brought that together this spring in bringing commissioners together to talk about how do we actually build better pathways to work, both nationally and locally. Our activity this month, and as we run into June, is just finishing the development of our report, but also a local costed proof of concept for consideration and discussion with local partners. Lots of involvement from SIMCA, from DWP and other colleagues locally in terms of talking through, without waiting for the national changes, what could we do locally to kind of prove the concept that we can work better as an integrated, holistic system with a more personalised support offer for residents, underpinned with good data and good governance. So again, we can come on to that if there's interest in the discussion, but lots of activity, and we're really looking forward to sharing the picture at the end of this process, I guess, of what we've found. So even if those dates change, we would love to kind of connect with people from this call afterwards, and invite you, whether that's to Barnsley or to our launch in Westminster when those dates are finalised. So a few reflections on health. I'm hoping none of this will be a surprise to those on the call, and in a sense it was encouraging listening to Adam and the fascinating work that's been done at national level by NHS England, because it just echoes, I think, lots of what we're finding from a local perspective, looking out and up. So health and worklessness, we won't spend long here, but it's clear that ill health is the major driver. It's the most significant reason people are out of work nationally. We know that in Barnsley, 2 in 5 of our residents out of work cite health as the primary reason. In our telephone survey of 750 economically inactive non-students in South Yorkshire, it found that 76% of those individuals who are out of work were managing a health condition. And when we asked people about the reasons their last job came to an end, for 1 in 2 people, personal illness was the reason, which is a really high figure. And then that rise in inactivity, we know, has actually been driven not just by a kind of pandemic related rise in ill health, but something predating the pandemic. And we know that's mirrored by more people in work also having to manage higher rates of illness now nationally. So clearly a really big issue that needs talking about and tackling. We know ill health has social and personal costs. So some data from the DWP there around the costs of an employed person moving out of work, just higher costs to the NHS, £1,000 more a year on average than if they'd remained in work, rising for someone with a disability. And then to offset that, I guess we've got the quote there from Kathy, a Barnsley resident, saying, I'd love to work because, you know, I've got it in me. You know, it's heartbreaking not being able to when I've got so much to give. And that just really shows to me the emotive sense of people who really do feel they need better pathways to work. I know Adam and Kirsten were talking about the health conditions, no major new insights from us there, but it's been really helpful to explore what some of those conditions are, to reflect on the significant proportion of people dealing with 2 or more health conditions, that multimorbidity challenge that Adam mentioned. Our qualitative research really highlighted how many people are juggling both ill health and caring responsibilities for others. And so some of the implications from that, both from our own reflections and when asking residents particularly what they think that means for support, is that residents were saying we really need that holistic integrated support. I'm not just managing ill health, I'm managing alongside X, Y and Z. Lots of comment and asks from our residents to see more supportive employers, and an interest in seeing health and employment support which is local, which is easy to access, where there's that trusted relationship and where it takes into account the whole picture, the wider family and household. All of those points being especially true for those with health conditions. So as we stepped back and reflected on raising participation, I guess some of the Commissioner's takeaways are that there's some really good examples of very effective and well-evidenced support for helping people with health conditions back into work, including what you'll hear about shortly, I think, from Working WIN. But it feels like there are still many opportunities for closer integration of health and employment services, whether that is through rolling out more employment advice and talking therapies, or making better use of social prescribing, or that co-location Adam mentioned in health settings. We found, interestingly, from our telephone survey that there's quite wide support, just under half of those inactive residents agreeing that opportunities for proactive upskilling or retraining whilst on NHS waiting lists would be a good, useful form of support for them. So thinking about what does waiting well mean for people. Definitely a lot of interest in and conversation around services being driven by outcomes and commissioning, and finding that often employment outcomes aren't part of health service provision, despite health professionals being that key touch point for those out of work. So that drives some of the challenges that we've faced around providing and analysing and integrating data because of that limited recording of health employment status in health settings. So to us, it feels like there's potentially missed opportunities for collaboration or signposting people at key moments of transition, when we know that those personal illnesses for 1 in 2 people are often the pathway out of work. So all of that worth noting, and of course public health incredibly important in terms of the wider prevention. The last piece here on health findings, just to say that the role of employers came through really strongly in the conversations our commissioners have had in terms of keeping a high labour market participation rate. Clearly stopping people from falling out in the first place is key. Lots of reflection on our role as a council, and with others, including many on this call, as large public sector anchor institutions, and how we lead the way in this. It's clear that some of our infrastructure to support workforce health in the UK lags behind some of our comparators. We know our access to occupational health provision or health insurance is still more limited across the board. We know that pay and conditions of work have significant health impacts. So reflecting on insecure work, they often experience worse mental health, and some of those more routine and physical roles have a real impact on health too. So a challenge back to us, I think, as a borough has been thinking about how do we raise the ambition around quality of work to support health in the borough. And finally, when we asked people in our telephone survey, do you think your fallout of work could have been prevented? For those who said yes, just under a quarter said part of what would have made the difference was support with their health and adjustments to their work arrangements to accommodate health needs. So just my last slide on impacts in terms of what we hope to kind of achieve and see through this commission. Through the life of it, part of what's been really important to us is just building a coalition of the willing in Barnsley and South Yorkshire, including a number of people on this call actually, and we found a real appetite from partners across the board to come together in raising our labour market participation. We've made the most of those direct outreach opportunities that we've had. So when doing the telephone survey and so on, we've seized the opportunity to offer people that support. And as we go, we're trying to share those insights with partners and providers, not just waiting for the big bang report launch, especially when things like a general election derail your plans. After the commission, we're hoping that this key vehicle for impact will be this proof of concept, a new model for us to kind of pilot and test out locally. And more on that in discussion time if there's interest. But nationally, really the key impacts need to come from a policy shift in relation to the national enablers that we'll set out in the report, particularly actually in relation, we think, to a shared ambition strategy and reducing the fragmentation of public services, which Adam mentioned at the national level. So a little update from us on what's been a fascinating year. Thanks very much.
Hannah, no, thank you.